Here's the melting pot where acupuncture, functional medicine, biomedicine, herbology, and nutrition are well integrated. Welcome to Acupuncture and Above. Hi everybody, thanks for watching Acupuncture and Above. In this episode, we're going to talk about the importance of vitamin B12. I'm also having Dr. Shao with us today. Besides a doctor of oriental medicine, Dr. Shao is also a licensed injection therapist. In his practice, he specialized in use of vitamin B12 to help people achieve improved health and wellness. So in today's episode, Dr. Shao will share his knowledge about what you need to know of vitamin B12.
Hello everyone, how are you? Let's talk about B12 today. Vitamin B12 is a water-soluble vitamin that plays a crucial role in many functions of our body. It helps in red blood cell formation, cell metabolism, nerve function, and it helps the production of DNA, which carries genetic information of human body. So, having adequate level of vitamin B12 is essential for maintaining good health. A deficiency in B12 can lead to anemia, nerve damage, and other health problems.
So where can we find vitamin B12 from our diet?
B12 mainly comes from animal-based foods such as meat, fish, poultry, eggs, and dairy products. Plant foods rarely has vitamin B12 unless they are fortified. So check the nutritional label when you are shopping.
I'm curious about the situation of B12 deficiency among adults. Do most people have enough B12?
That is a great question. I have data here. The data was published by CDC in 2021. Data from a survey conducted from 2011 to 2018 showed that an estimated 3.2% of U.S. adults aged 20 years and older had a B12 deficiency, which is about 8.2 million people. The research also showed that the prevalence of B12 deficiency increased with age, meaning that the older we get, the higher chances of B12 deficiency. One of the chief reasons is the absorption of B12. The absorption of B12 has two steps in the body. First, when we eat B12-rich foods like animal protein, our stomach produces hydrochloric acid to break down or separate B12 from the protein. In the second step, the freed B12 combines with a protein called intrinsic factor, which is produced in the stomach. Together, the B12 and the intrinsic factor are absorbed by the small intestines and transported to the liver, where they are stored until needed later on. So, here comes two possibilities where B12 deficiency can occur. If the stomach does not produce enough hydrochloric acid, food is not efficiently broken down to separate B12 from protein, resulting in a deficiency. Additionally, if the stomach does not produce enough intrinsic factor to combine with the free B12, it cannot be absorbed by the small intestines, leading to B12 deficiency. Unfortunately, several factors such as aging, stress, certain medications, H. pylori infection, stomach inflammation, gastrointestinal post-surgery, chronic inflammation, and pernicious anemia can contribute to this condition. Common medications that can interfere with B12 absorption include PPIs and H2 blockers, which are designed to suppress the overproduction of the stomach acid. People call them anti-acid drugs. This also blocks the absorption of vitamin B12. Another commonly used medication is metformin, which is used to treat type 2 diabetes. Some studies have suggested that long-term use of metformin may decrease the absorption of vitamin B12 by affecting the binding of intrinsic factor.
But how do I know if I have B12 deficiency? Does the lab report reflect the real conditions of B12 level?
That is a great question. Normally, a normal B12 serum level will indicate adequate B12 intake and absorption. But in some cases, even with normal B12 serum level, a patient may still have B12 deficiency. This is because the test only measures the amount of B12 in the blood circulation, not how much is being used by the body cells. If someone is experiencing symptoms of B12 deficiency, a healthcare provider may order additional lab tests to confirm.
That's very interesting.
Exactly. It's important to consider other factors, such as liver is a storage of B12. Do you know that 80% of the body's total B12 is stored in the liver? The liver releases B12 into the bloodstream as needed, and it can take several years for the body's B12 storage to become depleted if a person is not consuming enough B12 in their diet. How fast someone depletes their B12 storage can vary from person to person, and in some cases, the deficiency may already cause other health issues. Here are 9 common symptoms of B12 deficiency to watch out for: fatigue, pale or yellow skin, headache from neurological disorders, depressive symptoms and other mental conditions due to B12's role in the central nervous system, gastrointestinal issues such as diarrhea, constipation, and bloating, difficult concentrating and mental impairment due to negative impacts on the central nervous system, pain and inflammation of the mouth and tongue, paresthesia in hands and feet, such as burning or pins and needles, which may overlap with neuropathy. Other symptoms such as muscle cramps and weakness, impaired coordination, erectile dysfunction in men, and vision disturbances due to the damage to the optic nerve. However, it is important to know all those symptoms are not specific and can be caused by other factors. So, if you are experiencing any of those symptoms or have concerns about your B12 level, you should check with a healthcare provider.
What's the best way to ensure that you are getting enough B12 vitamins?
The best way? Through diet, of course. To eat a balanced diet that includes animal proteins. If you are strict vegan or vegetarian, you will need to take B12 supplements. Additionally, if you are over the age of 50 or have low hydrochloric acid levels, you may also benefit from B12 supplementation.
Yes, by the way, if you are not sure whether you have low hydrochloric acid level, we'll be creating a separate video to demonstrate how to test yourself at home. Okay, so here one more question. Will taking B12 supplements like pills or tablets be enough or sufficient to make up the deficiency?
Unfortunately, taking B12 pills may not be enough for these conditions because they can interfere with the second step of B12 absorption and lead to a lack of intrinsic factors that are necessary for B12 absorption. Under those conditions, I would like to recommend B12 injection because it bypasses both steps of absorption and is injected into the blood vessel and enters into the blood circulation directly.
No wonder I have many patients feeling surprisingly well after Dr. Shao's B12 injection. Besides their original complaint, they're feeling a lot improvement on their energies and mental concentration as well. There are also people who are looking for B12 injections for seasonal allergy management. So Dr. Shao, can you introduce about B12 injections for seasonal allergies?
Absolutely. Injection therapy has been a part of acupuncture practice for many years and is known as water acupuncture in China. Through my practice, I have found that using B12 injections provides the most ideal results for allergy relief. Specifically, I use B12 injections on acupuncture points that have proven to be the most effective for managing seasonal allergies. Interestingly, if the injection is not used on these specific acupuncture points, the results for allergy management are not as ideal. This further supports the idea that acupuncture points are unique and specialized locations on the body that can have specific benefits for various health conditions.
I can personally attest the effectiveness of this therapy. I have seasonal allergies to juniper in New Mexico, and in the past, of course, I treat myself. I used herbs, acupuncture, supplement, medications. pollen therapy, honey, etc., etc. So far, B12 injection is the best and most effective to me. I even act as a test subject for Dr. Shao to compare different modalities. I remember at the beginning, Dr. Shao put B12 injection on my gluteal area, which indeed helped my energy, but didn't help much for my allergy. And later on, he used B12 injection on different acupuncture points. And that make a difference, especially one of the points are really effective to relieve allergy symptoms. So also he used the saline water on that point he selected. I should say that the saline water does provide some effectiveness, but does not last long as B12 did. Okay, so this actually highlights the importance of selecting acupuncture points and using B12 as a medium to combine to make a good results for this condition.
That is right. Acupuncture knowledge is a powerful foundation for this therapy.
Great! Thank you so much for explaining the importance of vitamin B12, Dr. Shao.
My pleasure. Happy to share.
Until next time, take care of yourself and stay healthy. Bye for now.
Bye.